their children from the surge in the COVID-19 Delta variant. Getting some answers today from Dr. Chad Domingue, a North Shore neurologist and pain management expert with the Avila Physician Network. Thank you so much for joining us.
Absolutely. Always a pleasure. Good seeing you guys.
And for parents who want to know about the stats, what do we know about the stats out there in terms of children and the risk for getting Delta?
So last year, the static pulled was from October of last year. 11% of the overall infections were children, and luckily, about less than 5% got hospitalized. So it's much milder. With this variant, the Delta variant, it's 3 to 4 times higher. So to put a statistic that hits really close to home, the Children's Hospital in New Orleans. All of last year, 1% of admissions were from COVID. Already this year, 20% of admissions are related to COVID. As you know, there's no vaccine for children under 12. And it's not just COVID, Liz. This is summertime. Enterovirus, Coxsackie virus. There's a lot of viruses go around, but obviously COVID has our attention for good reasons.
And the symptoms parents should look for specifically?
Yeah, it's different than most viruses. You don't have the diarrhea, the stomach ache. Third of patients are asymptomatic. So a lot of kids don't know it. It's usually a fever, a headache, not feeling good, a little malaise. 14 days they can be asymptomatic with the virus. And when they have it, we see them having symptoms anywhere from 2 to 7 days. But again, these are not as sick as what we see in adults. So a lot of times their symptoms just kind of go, you know, my kid's got the crud, right? And just kind of get pushed to the side.
And the specific type of foods, before we focus on vitamins, the specific type of foods you think kids should load up on now?
Yeah, so, you know, as we talked about, you always want to do everything you can do to prevent any type of infections. And food's a big one. And I have 2 boys, so I struggle with these foods as well. And I'm not going to go through the list. It's posted on my social media, my website, Dr. Chad. But the vitamins we see, vitamin A, vitamin C, vitamin B, selenium, zinc, leafy vegetables, carrots, fish, almonds, spinach. So all things that we know are healthy, but certainly right now it's very important. 2 of the things I really found were good for prevention: good sleep, which is important, especially in the school year, and good dental hygiene. When you're talking about supplements, and again, this list will be on my website: calcium, vitamin B12, vitamin C, vitamin D, zinc, elderberry, and the dosages are much smaller than adults. For my children, I give them Juice Plus chewables. These are organic replacements of vitamins and so forth. I use an organic elderberry product, and I also use an organic vitamin, multivitamin, no sugars, no preservative type of stuff for my 2 boys.
Okay, and where can people find more on this list if they'd like to check it out? And of course, we always stress check with your doctor, especially your pediatrician, before you give your kids anything. But if they wanted to find out more information, where should they go to get that information on the things kids should be taking or looking at?
Yeah, so again, it's going to be on my social media, Dr. Chad, Facebook, Instagram, and then my website, Dr. Chad, spell the word doctor.com.
Right. Dr. Chad, thank you so much. I know you've got 2 boys, so you know what you're talking about. You're trying to keep them safe too, and just sharing that message with other parents as well. I really appreciate it.
Absolutely. To a safe and happy school year.
An apple a day keeps the doctor away. Okay, thank you. Appreciate it.